And welcome back to Body Beautiful. I'm Janelle Marie. With us today, plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different topics. We're also going to be posting the doctor's phone number later, so get ready to take that down. And remember, anything we say here today, talk to your physician first, of course. All right, next topic, tummy tucks. All the rage.
Okay.
We've heard about mommy makeovers and things, so let's talk tummy tucks.
Sure.
Who's a good candidate? Who's coming in for tummy tucks?
So tummy tucks take care of extra skin or loose muscle on the lower part of the abdomen.
Loose muscle, okay.
So, and if there's a little extra fat down there, it kind of goes away with the ride too. So most commonly for mommies, so after having kids, it tends to stretch out, especially that lower part of the abdomen.
Especially the muscles.
Yeah, and that, again, working out makes the muscle strong.
Yes.
But if the case is loose, it's still loose.
It's
the
never
guts
going to
tend
get
push
tighter,
forward.
no matter how much exercise
I think
you
it
do.
improves for about a year.
Oh,
And
okay.
about after a year after pregnancy, it's probably not going to get any better than that.
How is it performed? What do you do?
So very commonly, we make an incision at the lower part of the abdomen that lets me see the muscle and everything else. I can tighten all that up. It's sort of like putting a corset on inside.
I love that.
Makes it nice and flat.
Yeah.
And then we bring the extra skin down and trim off what's extra. The belly button is still your belly button, so I don't take the belly button and make a new one. I just leave it there on the muscle. The skin kind of gets pulled down over it.
Okay.
And then we make a new buttonhole to bring the belly button back through.
Oh, you make a new buttonhole.
So, yeah.
So people wonder, like, it's a belly button you just made out of clay or something?
No, sometimes people ask, do I get to keep my belly button?
Oh, get to keep
and
it. That's
the
bizarre.
vast majority of the time, the answer is yes.
Yeah.
Exceptions would be someone who has like an umbilical hernia where it's just totally effaced or flat.
Right.
Then we may not want to have the belly button. We may have to do the tummy tuck, then come back later and create one.
Okay.
Or there's some people that just have had previous surgery there and the stalk is not going to survive. And in those cases, again, we can make it later. And there's one type of tummy tuck that's sort of halfway between a mini and a full tummy tuck, which is a floating belly button.
What does that mean?
So in that one, instead of leaving the belly button on the muscle, we actually leave it in the skin and just drag it down a little bit.
Oh, how weird.
So for someone who has just a little bit of extra skin above the belly button,
That's what I was gonna
not
ask.
enough that we could reach the bottom,
Yeah.
that actually works pretty well. It helps if they have a naturally high belly button too.
Okay.
Because we are bringing it down. I don't want to make it unnaturally low. That would be weird.
That would be weird.
We want it to be in the normal range still.
So let's talk about scarring. Women always, they love the thought of a tummy tuck, but they're saying, look, I'm going to be scarred. I can't wear a bathing suit ever again. That's not too bad, is it?
No, the scar's low enough you can still wear a two-piece. You can still wear a bathing suit. The scar that's more visible is the one around the belly button. And what I try and do is keep that small and sort of inside the curve of the belly button so it's less noticeable.
And eventually the scar's going to fade anyway, correct?
Yeah, and a lot of the folks, they're happy because they can wear what they want, and they wouldn't have worn it without the tummy tuck.
Good point.
There's
We've
just
got
too much
some
fullness
pictures.
there.
Absolutely. Picture number one. Oh, that's beautiful.
So here you can see so the muscle is relaxed.
Okay.
You can see the guts kind of pushing out away from the side. That little shadow there is the side of the rectus muscle.
Oh.
Afterwards, that's actually been pulled more towards the front because we're tightening up the midline. And it just helps to smooth everything out. The scar does come down a little bit there, so you can see it underneath the underwear in the front.
Oh yeah, just a little, right there in the after photo. Yeah, that's
so
not bad.
even low-rise jeans, wherever you want to wear, will still be hidden.
Not bad at all. At least I'm thinking about that. That's good. Now, what if you just had a little loose skin, before we get to the next picture, just a little loose skin, and maybe you don't need the muscles tightened. Can you do a mini tummy tuck without the big scar?
Well, a mini tummy tuck, the scar length is determined by how much skin there is.
Oh, okay.
So usually a mini tummy tuck has a smaller scar just because there's less skin.
Okay.
And it removes about half of what's between the belly button and the pubic region. The only downside I found with that is once in a while, if someone gains weight, that fat area, that tends to come back in that lower area. So then we have to go back and do lipo or do something else. If we can do a full tummy tuck, usually that upper skin above the belly button doesn't gain that weight.
All right, here's a before and after.
So here, great shape. Really not overweight at all, but just has that skin hanging over the belt line. No, that's a woman.
Oh, okay, okay.
Yeah, no, it's the children
You
will do that.
you do tummy tucks on men, though?
Absolutely. Yeah, it's just not as common, again, because of the way we put fat.
So
Men, we tend to put fat behind the muscle, so unless we lose it, it's really hard to do a tummy tuck.
I gotcha. Okay.
So here, too, very athletic. You can see how
That's a great result
that
there.
side line of the rectus, that muscle, that really cleans up, looks nice and
She
smooth.
didn't have too much in the before picture. It doesn't look too bad, but is that just muscle
You could not
sagging?
tell her that.
Oh, no, of course not.
It was
She's
the
like,
worst
get rid
thing
of
ever.
this. Absolutely.
And I do always tell people I've seen worse because someone like this is, they're in
not
really
too
good shape.
bad. Yeah.
But you can see there's a dent where the belly button is. There's another fullness down underneath. You just clean all it up, make it smooth.
Was that after
and
baby?
then sometimes we'll do a little liposuction on the flanks, on the sides there, just to make sure everything matches.
Because you can do that back kind of sculpting out with the liposuction, right?
Yes.
That's kind of in now.
Because that skin is pretty thick. It doesn't fold over.
Oh, okay. So
tends
it's a
to do
good place for lipo?
Yeah, the hard part is the skin's thick, so we can't. Sometimes people will pinch it and go, "Oh, there's still fat there."
Yeah.
It's skin.
Oh, gotcha. Before and after here?
So here, and I did this one purposely. It's kind of early, so you can see the scar where it is.
Oh, yeah.
It's kind of red, still healing. It takes about a year for it to heal all the way.
Scar, though.
I just need to go as far as the skin folds.
Okay.
So if you look at the before picture where that little shadow is where the skin folds, that's usually about the length of the scar.
I don't think that's bad at all. And if that's right after surgery, it's only going to get better and better.
Yeah, no, it just continues to heal. And there's still probably a little bit of swelling down at the bottom.
It's a great result. It looks really good. One more before and after?
So same thing, just thin person, loose skin. So we took out all the skin, just brought it all down, tightened up the
really
muscle
good.
underneath.
And a lot of people do the whole mommy makeover with this also, too, right?
And I think in this case I did. I think
Was
I
it a
did
mommy makeover?
breast augmentation with
Gotcha.
a lift in addition.
Because that's really popular. Once you've had all your babies, right? Let's
Yeah, it's
tighten
better
everything
once
up.
you're done.
All right.
Yeah, if you're trying
Last
to get
before and
pregnant,
after
don't do
here.
it. So here's someone with different problems. So she's had
really
previous
good.
surgery. You can see a shadow kind of running along the bottom before.
Yeah.
There's kind of an indentation there. The muscle tone is all lost. It's just all stretched out. So a lot of muscle repair, a lot of skin removal so we can get rid of the scar that's there.
Wow, that's a great.
It just makes
great-
everything
yeah.
smooth. Because in a bathing suit, not only was it full, but you could see the dent from the scar. Now everything's nice and smooth.
Great after picture. All right. Good job. For more information
It's a
about
good
Dr.
procedure.
It is a good procedure. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, drmealy.com or sanfranciscobreast.com. We have more with Dr. Mealy, so keep it right here on Body Beautiful.
Body Beautiful.
Body Beautiful.
There you go.
We'll be right back.